Hi, you're watching this video because you are scheduled for an arthroscopic labral repair. I made this video to serve as a reference for you, to answer any questions about what we're doing during the surgery, but also as a reference for things that we want you to do after the surgery. So during the surgery itself, I will arthroscopically, through little poke holes around the shoulder, repair that labral tear for you. After the surgery, we'll place you into a sling. I want you in that sling for the first 4 weeks. During that time, I really don't want you using the arm for anything. So every time you bring the arm away from the body, you test that repair and it may not heal. So things that are okay to use that arm for, working on a computer, reading a book, holding a phone, all those are okay as long as it doesn't involve you bringing your arm away from the body. Additionally, there are a lot of things that we're going to do on the day of surgery to help you out with your pain. You'll meet with the anesthesiologist ahead of time and they will talk to you about doing a block. That's where they inject some numbing medicine into the arm. That usually numbs up the arm for about 1.5 to 2 days. During that time, you may notice some numbness in the arm, some weakness in the fingers. That's all normal. Everything should be back to normal within 3 to 4 days of the surgery. Additionally, we will send some medications over to your pharmacy prior to the surgery, so please pick those up. So 2 types of pain medications. There's your non-narcotics and your narcotics. The non-narcotics are where I want you to start. The day you get home from surgery, go ahead and start taking these as the sheet that you go home with describes. So diclofenac is going to be your anti-inflammatory. You'll take that breakfast and night with dinner. Tylenol is your pain pill. You'll take that 3 or 4 times a day as needed. Additionally, gabapentin. So take that medication at night before you go to bed because it will also make you groggy. Ice, ice, ice. Ice pack, ice machine, whatever you got, be aggressive. Good rule of thumb is 20 minutes on, 20 minutes off while you're awake for the first few weeks. One thing to keep in mind is that early on, you want to make sure there's a towel on your skin. With that block, your arm is numb and you can't feel how cold that ice pack is getting, and it can cause frostbite. So make sure you have a towel on your skin. If all that's not enough, we will give you a prescription for a strong narcotic. Take it if you need it. If you don't feel like you need it, you do not have to take it. It is strictly only for the time when everything else isn't working and your pain is more than you want it to be. If you take the narcotic, make sure you take a stool softener with it because that medication can make you constipated. Also, with any surgical procedure, there's a concern for a blood clot. So I want you to take a full aspirin, 325 milligrams, every morning with breakfast for the first 2 weeks. Also, I want you to keep the compression stockings on that we put on after the surgery for the first 2 weeks. You can take them off at night when you sleep, but during the day it's a good idea to have those compression stockings on because they also do help prevent blood clot formation. If there's any questions about this or any other questions in general, please feel free to reach out to us and we can talk about it over the phone. Thanks and see you soon.